Hello, my name is Dr. Bernard Rosenfeld, and I am the physician who performs abortions at Houston Women's Clinic, and I have been at Houston Women's Clinic performing elective abortions since 1980. I would like you to know the following information about myself. I received my medical degree at Tufts University in Boston in 1971, and I have had advanced training in gynecology and obstetrics at the Johns Hopkins University, at the University of Southern California, and Wayne State University. I was on the faculty at Baylor College of Medicine for 13 years. I am currently in full-time practice at the Texas Medical Center, and I am on staff at St. Luke's Hospital, Methodist Hospital, and Women's Hospital at the Texas Medical Center. A law passed in Texas called the Women's Right to Know in January 2004 requires you to have the following information at least 24 hours prior to obtaining an elective abortion. I personally urge women to take as much time as they feel necessary to make this important decision, and please do not feel there is any urgency in making an important decision such as this. Please feel free to call us at Houston Women's Clinic for any additional information and to answer all your questions.
Let us explain how gestational age is calculated. We use the first day of the last normal menstrual period and count from there. If your period started 6 weeks and 2 days ago, that is how far pregnant you are. Occasionally, women will miss a period for reasons other than pregnancy, and some women may have a period while pregnant. For that reason, we perform an ultrasound on every patient at the clinic to confirm gestational age. We must also explain the medical risks of abortion and risks of childbirth. The medical risks of an abortion are significantly lower than the risks of carrying a pregnancy to term. Overall, acceptable medical studies show that the combined medical risks of minor and major complications are less than 1% with an abortion. However, there are some similar risks with abortion and childbirth, such as bleeding, infection, and injury to other organs. Infection can occur with abortion, childbirth, or any other surgical procedure. This can be treated with antibiotics, and in some cases, a repeat procedure is needed. Rarely, hospitalization or surgery may be required. Other risks with abortion are hemorrhage or heavy bleeding, laceration of the cervix, perforation of the uterus, and injury to other organs. Treatment could include medication, a surgical procedure, blood transfusion, and rarely a hysterectomy. It is important to note that the death rate for childbirth is 12 per 100,000, and for abortion, it's less than 1 per 100,000. We have never had a death from an abortion at Houston Women's Clinic. Risks specific for second or third trimester abortions and childbirth include the possibility of blood clots traveling to the lungs, preeclampsia or toxemia, and the related complications. There is one risk unique to abortion, and that is the failure to end the pregnancy. It is unlikely that an uncomplicated first trimester abortion will cause a problem with future pregnancies. Some studies show an increased risk of breast cancer with abortion. However, the American Cancer Society does not feel that there is an increased risk in breast cancer with abortion. There are a few more things we need to discuss. Medical assistance benefits may be available for prenatal care, childbirth, and neonatal care.